Hi, I'm Dr. Alison Ventura, and I'd like to tell you about my manuscript entitled Developmental Trajectories of Bottle Feeding During Infancy and Their Association with Weight Gain. Previous research illustrates that infants who gain too much and grow too fast during the first year are at significantly higher risk for obesity during later childhood. Additionally, one of the strongest predictors of rapid weight gain is infant bottle feeding, but our understanding of the mechanisms underlying this association are lacking. Now, one factor limiting our understanding of how and why bottle feeding is linked to rapid weight gain is the fact that previous research has adopted somewhat simplistic approaches to describing infants' feeding histories. Most often, infant feeding history is conceptualized as the number of months that the infant was breastfed, with no real consideration of the extent to which breast milk was delivered directly from the breast versus from a bottle. Now, the problem with these more simplistic approaches is that the milk type, that is, the formula versus human milk the infant is given, is typically confounded with the mode of milk delivery, that is, a bottle versus a breast. And recent research illustrates that considering both the independent and the synergistic effects of these two factors may be important for understanding links between infant feeding and risk for rapid weight gain. Now, also consider this. Only around 8% of infants are exclusively breastfed from the breast for the duration of infancy, whereas another quarter are exclusively formula fed from a bottle for the entirety of infancy. So that means the vast majority of infants experience a more complex and dynamic feeding history, receiving a mix of breast milk and formula from both breasts and bottles. So to merely classify these infants as breast versus formula fed or condense their feeding experiences to months breastfed may oversimplify their early feeding exposures. So in my paper, I address these limitations and provide new information about individual differences and patterns of bottle feeding during the first year. Now, in particular, I used a group-based trajectory modeling approach to identify and describe patterns of bottle feeding during infancy. This data-driven approach allows for the identification of developmental trajectories without these a priori assumptions regarding which individuals should be classified into which group. So it provides a great and innovative approach to identify clusters of infants who share similar patterns of feeding. So one of the key findings from my study was that bottle feeding was associated with more problematic weight gain trajectories and higher weight status at 12 months for some, but not all, infants. In particular, it was only those infants who showed high-intensity bottle feeding during the first 6 months that had more problematic weight gain trajectories and higher weight status at 12 months. These patterns remained after controlling for characteristics of mothers and infants, as well as controlling for the amount of breast milk that infants received. So one of the exciting things about this study is that I was able to apply an innovative and data-driven approach that really allowed for a more complex and accurate visualization of the balance between breast and bottle feeding that occurs for different infants, that gives us new information about how bottle feeding is associated with weight gain during infancy. Findings from the study also suggest that supports and policies to help mothers delay high-intensity bottle use until later infancy may be warranted. I invite you to read the full text, which is published in the journal Developmental and Behavioral Pediatrics. Thanks.